So let me elaborate on what are some of these adjustments that we can expect over the next few days. First, we will take a much more focused approach to contact tracing. So far, most of the contact tracing pertains to air passengers sitting close to confirmed cases. But with community spread, the likelihood of infection has now shifted to the local community instead of only in the aeroplane cabin. So we have started to scale down such contact tracing. Contact tracing henceforth will be decided on a case-by-case basis by our public health experts, taking into account the medical condition of the infected patients while they were on board. Isolating close family members of confirmed cases, however, remains a useful control measure. Likewise, temperature screening at borders remains useful. We know this is not foolproof, but it is useful. If you look at our cases, 1 in 4 of the confirmed cases, imported cases, were picked up by the scanners. Second, we have ramped up our laboratory facilities. So by now, all our major hospital labs are capable of testing and confirming H1N1. Third, we have geared up all our public hospitals to handle H1N1 cases. 993 ambulances have begun sending suspect patients to all public hospitals and not just Tan Tock Seng and KKH. We have also refined our workflow. 993 ambulances now send the majority of the suspect cases judged by the doctors to be mild to go home after their swabs have been taken. And the patients can then rest at home while they wait for the lab results. I think this has made the experience much more humane for these suspect patients. I, of course, expect such people to behave responsibly and to rest at home while waiting for the results, since they are clearly unwell and they really should not be wondering about. Fourth, as we need to create capacity for H1N1 patients with comorbidities, we will be refining the treatment protocol for infected cases. Not all patients need to be hospitalized. If we look at the experiences in North America in particular, because they have longer history of dealing with these patients, the vast majority of the patients, in fact, are just sent home with antivirals, and only very few are hospitalized. Many will simply be put on antiviral treatment and be home quarantined and asked to monitor their condition. We will also review the use of Tamiflu for close contacts of confirmed cases. Fifth, we are gearing up our polyclinics and a few hundred GPs to treat suspect H1N1 cases. We call them PPC, Pandemic Preparedness Clinics. A bit of a mouthful. I would have preferred to call them just flu clinics. But they can be recognized by their decal with a tick mark and with a ready marks to show that they are ready to handle walk-in suspect flu cases. And they will only refer some categories of high-risk suspect patients to public hospitals. We will use the next few days to publicize to Singaporeans where are these PPCs, and according to where you live, where you work, so that you know in case you develop some flu symptoms and you know where to seek advice. When the local biosurveillance data confirms significant community spread and we need to move from containment to full mitigation, we will signal to the public to use these PPCs instead of going to the hospitals if their flu conditions are mild. And this may happen over the next few days. Six, we will secure adequate supply of H1N1 vaccine for our people. Besides our existing supply contract with a vaccine manufacturer, we are also in active negotiation with other vaccine manufacturers. The objective is to diversify our supply of H1N1 vaccines, because the vaccines produced by each one of them are not exactly identical. An important consideration will be which manufacturer can promise the best delivery timeline. But these are new vaccines, so they are still subject to clinical trials to ensure safety and effectiveness. So I think we should be realistic about the timeline for availability of a safe-to-use vaccine. Seventh, our scientific committee, which is chaired by DMS, is actively evaluating the characteristics and the genome of the virus. The good news is that the virus here remains identical with the virus in North America. You may remember there was an earlier press report about some Brazilian claim that the virus there has mutated and was no longer the same as the North American virus. But I think the report has since been found to be flawed. So the consensus view is that the virus remains moderate risk as described by WHO. Singaporeans, therefore, really do not need to panic over this development that there is now community spread in Singapore. Almost all infected cases will be able to recover fully. Tamiflu and Relenza remains effective against this disease.